Good evening and thanks for joining us. We begin with a hot topic among experts in infectious disease and air quality, the airborne transmission of the novel coronavirus. 239 scientists from 32 countries have signed a paper saying we appeal to the medical community and to the relevant national and international bodies to recognize the potential for airborne spread of COVID-19. The concern is about microscopic droplets that linger in the air and can travel further than 2 meters and could be infectious, especially in enclosed spaces with poor ventilation. Goomansingh on the evolving evidence of airborne transmission.
The virus that causes COVID-19 travels in microscopic droplets, and a large number of scientists around the world want more attention put on those very tiny particles that can stay circulating in a room.
There's a lot of evidence that suggests that airborne transmission can be part of the mechanism involved, and that this really had been downplayed.
The director of the Southern Ontario Centre for Atmospheric Aerosol Research is one of more than 200 experts calling on the World Health Organization to acknowledge the issue and advocate for better air quality systems. Dr. Michael Gardam remains concerned about transmission, even if requirements for better air filtration systems were mandated.
Bars and restaurants are perfect scenarios for that. They're loud, you're right up close with somebody yelling in their face, you may be half drunk, so you're not paying attention to what you're doing. All of that makes it highly likely that this could spread. If you were to increase the ventilation to deal with airborne, that's not going to deal with that face-to-face.
That face-to-face close exchange is believed to be how the majority of infections occur. That's why people are told to keep their distance, wear masks, and to wash their hands. But the authors of this article are putting pressure on the WHO, saying more needs to be done. The WHO responded saying, "We are aware of the article and are reviewing its contents with our technical experts." As more people head out and back to work, Greg Evans wants them to be aware of their environment.
How much of the breath is what we call rebreath or exhaled breath in the room? So what is the potential for exposure to occur if there is somebody who's infected in that space?
The scientists concerned about aerosol transmission say it's not about creating fear, but about giving the public all of the information. Goomansingh, Global News, London.
It is well established the novel coronavirus can spread through large droplets expelled when an infected person coughs, sneezes, speaks, or sings. They can spread it up to 2 meters or more, depending on their size. That's why we have the 2-meter physical distancing rule and why we encourage wearing masks when that's not possible. This latest research says microdroplets are a potential risk, too. They're just 5 microns in size. A single grain of table salt is about 100 microns. Microdroplets or aerosols can remain aloft longer and spread further. Diseases like measles, chickenpox, and tuberculosis can be spread through airborne transmission. And the experts behind this latest research admit the evidence for all the steps in COVID-19 microdroplet transmission is incomplete, but they do say simple measures like good ventilation, fresh air circulation, and avoiding overcrowding are precautions worth taking. Well, there are lots of things we still don't fully understand about COVID-19, and now there are fresh questions about the origins of the virus. It's widely believed the virus first emerged in China in late 2019 after jumping from animals to humans. Now, an epidemiologist at Oxford University says there's evidence the virus may have been dormant around the world long before the first confirmed case. That theory is based in large part on evidence from Italy, Brazil, and Spain that found traces of the virus in wastewater samples as early as March 2019, 9 months before it emerged in China. The Oxford scientist says experts investigating COVID-19's origins should consider that it may have lain dormant around the world and emerged when the environmental conditions were right for it to thrive.